Trying to prevent the next pandemic is a highly complex task that requires an interdisciplinary team that can take into account the social determinants of health that vary by region of the world. For prevention, we therefore decided to focus on recommendations that prioritize the most susceptible populations and target interventions with the highest yield results. First, we recommend prioritizing vulnerable populations, including, for example, mothers and children and people living in poverty. There is also a need to strengthen local emergency care services and to address current communicable diseases such as neglected tropical diseases. Similarly, we recognize the enormous impact of physical illness on mental health, especially in migrant and working populations. And finally, to be able to carry out all of these tasks, we need to care for and value our health workers, who are susceptible to burnout and need more support.
First, we will focus on the vulnerable population, who are more likely to experience disruptions in education, have reduced access to healthcare, ID and centers, experience domestic violence, and food and economic insecurity. As a result, we recommend having a local response team that encourages and accumulates local and foreign donations. This team can ensure the distribution of healthcare investigational and treatment resources, non-perishable food items, educational materials, sanitation products, and technology, along with the education on how to use it for school and work. This response team would also be responsible for checking in with families through video calls to look out for any risks of abuse or violence at home. Lastly, this team can act as both confirmers of a person's homeless status to help them gain a health identification at a lower cost, as well as offering to store the identification for safekeeping.
Our next recommendation is regarding how emergency care services should be organized in each country. There is current guidelines regarding the access to adequate hand hygiene, prioritizing essential services, removing financial barriers, and strengthening communication strategies. We propose prioritizing the development of local guidelines, constant support of an open trade system to ensure access to global supplies to every country, enhancing the need of international cooperation. Lastly, in terms of outbreaks, quarantines should be established after assessing the country's population density, formal or informal work predominance, mobility, and transport characteristics. Partial quarantines, or by sectors, has shown to be an effective measure in countries in Africa, like Algeria or Zimbabwe, for example.
Next, in order to promote health equity and prevent another pandemic, it is crucial that we reduce the global burden of existing communicable diseases. Neglected tropical diseases, or NTDs, are a group of diseases listed by the World Health Organization that affect over 1 billion people worldwide, and yet they've received little attention compared to COVID-19 because they mainly impact low-income developing nations and trap their populations in poverty. While the World Health Organization works with governments, scientists, industry, and other experts to address these diseases and develop new diagnostics and treatments, we recommend that, keeping in mind the lessons learned from the distribution of the COVID vaccine, the development of new interventions must be coordinated with target countries' existing technology and existing capacity to implement them. This way, they won't need to rely on external resources and production, which will allow them to work sustainably to eradicate NTDs.
Mental health issues are a growing pathology gaining more and more prevalence around the world, and the global pandemic of COVID-19 is one of the biggest factors of its growth. The pandemic demonstrated that there are more prevalent people suffering from these diseases, where immigrant population, healthcare workforce, and health students seem to be more affected. It has been shown that people suffering from mental health issues are less likely to take action of their own health and participate in prevention self-care in case of another pandemic outbreak. The measures that must be taken for these types of diseases have to be adjusted according to the population. In case of the immigrant one, making information accessible, available in their main languages, and throughout communities and healthcare centers are the biggest ones. The best cost-efficient measure that all countries can take part in is reinforcing the idea of a local community that delivers appropriate information about self-care and promotes better mental health.
And finally, challenges from the COVID-19 pandemic have led to greater burnout and psychological distress in members of the health workforce in many countries. This is an issue as the health workforce is integral to tackling future public health crises and has great potential to reduce health inequalities in the long term. We propose countries ensure availability and access to mental health support programs, such as resilience and self-care courses for healthcare workers. Telemedicine can also be used as a strategy. Frontline workers in China had positive experiences with telemedicine centers in reducing workload. And for improvements in the domain of reducing health inequalities, we recommend countries promote greater diversity of healthcare workers, both across ethnic racial minorities and across differing communities. This approach has led to better healthcare access and outcomes in the U.S.
By prioritizing vulnerable populations, strengthening emergency care services, reducing communicable diseases, focusing on mental health, and supporting healthcare workers, we hope to strengthen the foundations of healthcare worldwide to prevent the tolls of the next pandemic. Thank you for listening.